Welcome back. We're here at the lovely Renaissance Shop, sponsored by the Lake Sunapee Region VNA and Hospice. And coming to us now, we have President and CEO of Lake Sunapee Region VNA and Hospice, Jim Culhane. Thank you for hosting us.
Oh, thank you very much for coming here. It's nice to see you again.
It's always nice to tape here in the summer.
Yes.
You've got a really great new program, Ounce of Prevention, that you want to tell us about.
Yeah, so the Ounce of Prevention program is a program that we kind of developed and rolled out in kind of a pilot form last year, and then after realizing the success we were having with it, we wanted to broaden it. And it really stems from our transition and attempting to move as best as possible into providing preventative services.
Yes.
As we've probably talked before, a lot of what we do is post-acute, or we see people after they've been in the hospital, after they've been ill or had surgery or an injury. Yes. And we're really trying to segue into providing more preventative services, preventing them from going to the emergency room or preventing them from having complications in the first place. And after doing a fair amount of research, we decided that we wanted to create a program that would begin to work with people to really identify risk issues in the home before they fell and fractured a hip, before they had complications from mismanaging their medications. So we wanted to create kind of a screening and a visit where we could meet with people at an earlier stage. There's a lot of data out there that talk about by the time an individual shows up at the emergency room having fallen and fractured a hip, they probably fell in the home several times in the previous 6 or 12 months. So we really wanted to try to identify those people who may have a risk factor but haven't arrived at the emergency room yet. So we created the screening tool and began to roll it out in a pilot model to different people, different entities, and people that we think would be helpful. We wanted to kind of create a system where we were tapping into what we would call kind of an informal referral source. And a lot of times I refer to informal referral sources as something other than the traditional physician or hospital. And the reason for that is a lot of the people that we're talking about, a lot of the patients we're talking about, they're not necessarily on that physician's radar at this stage.
That's right.
They haven't arisen to that level of acuity that they're even on the physician's radar. And you could argue, at least in some circumstances, that when they finally do arrive on the physician's radar, it may be a little late. So how do we tap into, who do we talk to that might be aware of these people in the community and the communities that we serve that are struggling? So we're talking about fire departments. They have a wonderful knowledge of who is and who is not terribly successful in the home.
Sure.
Pharmacists have a good understanding of who may or may not be taking care of, taking their medications appropriately.
Yes.
Even informal referral sources such as volunteer organizations, such as the Council on Aging.
Yeah.
And probably as, if not most importantly, family members and the patients themselves.
Absolutely.
So we frequently talk to brother, sister, mother, father, son, daughter, whatnot, who's concerned about a loved one who's not doing poorly in the home, but not necessarily doing well.
Starting the decline, right,
exactly.
Of course.
Exactly. So it really entails having an occupational therapist, and we specifically use occupational therapists because they have a very broad understanding of functioning in the home, and they can assess a broad range of items and areas. And the occupational therapist meets with the individual and kind of goes through a checklist of how are things in the home.
Yes.
And out of that comes a general idea of how they're functioning. That is then followed up with a call with the patient's permission to the physician to say, we saw your patient and here's some thoughts, here's some recommendations. And those recommendations may include anything from probably good to go see the physician because you're confused about your medications. It may be necessary for you to have a home care referral because physical therapy or nursing or other formal services may be needed. You could benefit from socialization. How about a referral to the Council on Aging or some other organization? So really trying to identify what the needs of the individual in the home are, and then hopefully, if the person's in agreement, helping to facilitate that. We started as a pilot program and really just trying to get a sense of what feedback and trying to fine tune it. But in the last few months, we've realized the value of it and have really pushed a more aggressive model to really tap into where we see a lot of need. We're doing a lot of work, obviously, in and around the New London area, but very heavily in the Claremont and Newport area as well, where we identified need.
Yeah.
And in addition to that, we're doing a fair amount of work up in the Upper Valley, so up towards Hanover, Lebanon area, with some very good success. So It's a free service. This is not something that's paid for
Terrific.
by either the client, the patient, or the insurance. It's something that we feel is necessary from a mission, and we feel is necessary from a preventative services model, as we try to stave off people having to go to the emergency room in the first place.
Right.
So
Saving a lot of incidents and lots of money as well. Yes, it's terrific.
that's the goal.
Yeah.
That's the goal.
Now, what's the best way if someone would like to have this evaluation done on a loved one or at their own home to find out?
It's very simple,
Okay.
and again, it follows a much simpler model than some of the other care that we provide, which is an individual just needs to call in. It doesn't have to be a physician office. It can be a family member. It can be the patient themselves. It can be a concerned
okay,
neighbor.
Good, perfect.
Just
good.
call into
Just
the
call in.
agency,
Excellent.
526-4077, and
Yes.
ask for an ounce of prevention.
Okay.
We always ask, we want to make sure that the person we're talking about is in agreement with the visit,
Yes.
because we have at times had phone calls from friends of family members who certainly wish the best, but may not necessarily be in alignment with what the patient would like.
Right.
But as long as the patient is in agreement, which they obviously frequently are,
Yes.
then our goal is obviously to come out. We always come at it from the standpoint that our job is to help people stay in their homes as long as possible. So this is an opportunity for us to work with an individual to really help promote, potentially put in services to keep you in home really for as long as you'd like, and that's our goal.
That's terrific. Wonderful. Well, thank you so much. You always bring such great health to our area. This is just another
Excellent.
example of a great program.
Yeah, thank you very much. Yeah, we're excited about it and getting busy because of it, so that's a good
Absolutely.
thing. So,
Super.
that's
Okay,
good.
well, thank you, Jim.
Thanks,
Take
Lynn. I
care.
appreciate it.